every 20 minutes a child is diagnosed with an autism spectrum disorder. In fact, autism is the fastest growing developmental disability in the U.S. It now affects at least 1 in 150 children. Michelle Turner of Movement Lesson and a mother with an autistic son has some help for these children and their parents. Welcome, Michelle.
Thank you for having me.
So first of all, what
Isn't she adorable?
You have a live baby there. This is amazing, Michelle. But let me ask you, what is autism spectrum disorder?
Autism covers a lot of things, but autism is really a movement disorder. When a child can't talk or point, and all of those social skills, looking around the room, all have to do with their movements. So if you can catch it when it's early enough and start working with their movements, then hopefully you can either prevent it or lessen the severity of it.
I find that absolutely amazing. How did you come upon this? Is this something that you learned about, Michelle, or something that you found out about otherwise?
No, I learned about it through my child, and then working with everybody else. I realized that all kids with special needs have issues with their rotation or twisting. Why can't a child point with autism? They can't twist their arm. Why can't they work the room? Because they can't twist their neck. So I developed a way of examining all babies right at birth to make sure that their rotation is okay throughout their body.
Well, you have a marvelous little model there. So would you mind showing us some of the things you do to test newborns for autism?
It's quite easy. Everything is on my site as well with videos, so if you can't remember all of this, you're just going to go to each section of their body, like here her pelvis or her knee, and just start making sure that each section rotates or twists. Go through her pelvis all together, her back. It looks like I'm just gently rocking her around, but this little girl is the second time I've seen her, and she had torticollis the first time, and her neck is just fine as she's coming to her belly.
And so how do you actually relate this to autism? All these movements.
Again, with autism, why don't you have peripheral vision around that you can scope a room? Maybe that your neck didn't move well as a baby. Again, the pointing and the rotation of the hands can be caught all in the beginnings. There's been a link that C-sections, again, not stimulated a surgical birth. Again, you're there to save the mother. I'm not faulting C-sections, but again, did that child have the right environment to start doing things? Maybe you decided to bottle feed versus nursing. Nursing is just going to offer different movement patterns like extension through the mouth, looking for the mother, where a bottle doesn't necessarily have. Again, I'm not faulting either one of feeding and nurturing your child. I'm just saying that they offer different movement patterns.
So if you don't see these movement patterns in these infants, Michelle, then what? Is there a cure for it? Are there things that can do that you think stimulate the brain to change what might be autism?
Again, the child will only learn by responding to stimuli, and if the child can't respond to stimuli, then they're not going to learn. So if you can offer them stimuli, especially through a nice little gentle touch, then they will start to learn. Any baby would learn from this, not just the autism.
Now, you have a son who has autism, Michelle. How did you first realize that he did have this, and were you involved in this at the time, or did it come later?
This came later. This came all for him. I had no intentions of being here with you. I was just only to save my son. I had no early warning. I thought my son was just sick and he was going to get better. I really wish that this was around, that I could have been more aggressive with his care. So his care took a lot longer to do, and he still has full-blown autism, but however, he's mainstream and gifted program and a straight A student. So he's doing very well academically and socially that way.
Was there help out there when you discovered that your son was autistic, Michelle?
There was help, but it was more of a diagnosis and not necessarily of therapies that I felt helped my family and his situation. He had an infection in his head and it affected his vision, which again would affect his movements because of pain of the infection, which we didn't know the infection was there till he was 4.
Amazing. Now, with this newborn assessment, you said it's important to do it early. Because is there somewhat of a cure or something that can be changed if you realize that they may be autistic?
There's not necessarily a cure if it's genetic-based autism. There are a couple of forms of genetic-based autism. However, if it's a movement-based autism, then yes, you want to start enhancing their movements of any baby when they're born, or as soon as you know that they're not moving right. And a lot of parents can start to tell. They go, my baby's not looking at me right, or I have trouble feeding it. And these little things become bigger things later. Why not sort of nip it in the bud or catch it while they are still, at this age?
Exactly. Now, if you determine some of these things, does autism have any relation to other kinds of situations, limitations or problems with children that they may encounter?
Most children with autism, depending on the severity of the autism, will have trouble specifically with eye contact is the number one thing. Even my son to this day can't look at me straight on. He'll look at me this way, and when he talks, when he's done talking, he can kind of come back to me. The eye contact is the most obvious. Not having the eye contact, not looking to see what Joey's doing on the park, they start declining in their social abilities and things like that. So those are autistic traits that show up quite commonly.
How did this, are you a nurse? What was your background, Michelle, in terms of getting these kinds of movements, understanding them, seeing them, changing them?
No, I'm just a mom with a little bit of an attitude. I was just determined to help my own son. They said he would never stand, he would never walk. My son was severely globally delayed. And I said, he's just 2, he's not going to drive a car tomorrow. I realized that. Can we work on this? And I just would go after anything that would help him. And then this was the first thing that I noticed the biggest changes for him.
Wow, do you have anything like nutrition and that kind of thing that can help parents possibly?
There's always nutrition. Again, your child's going to do better when they can. Unfortunately, the biggest side effect also of autism is a very limited diet, which I deal with every day, even with a 13-year-old now. And that's just things that's going to take time with your child, depending on how they can eat or not. But always, as with you and I, if we eat better, we do better.
Well, and back to the movement assessment. Now, you said there's a video online, and also I believe do you have a book out on this, Michelle?
Yes, my book just came out. It's a newborn movement assessment. It just gives you very easy step-by-step instructions. You evaluate the birth of the child, you evaluate their rotation, and then you initiate a gentle, healthy touch, which I'm sort of calling a bright future. Birth, rotation, initiate, gentle, healthy touch. And again, there's videos to go with every section, so it wasn't going to be confusing for a parent, or they can just follow along with me as they evaluate their own child.
Wow, that's phenomenal. So you believe that a lot of these things can be turned around and are certainly helped in terms of the autistic child with your movement?
They help anyone get to know their child, and the more you get to know your child early on, instead of just worrying about if they're just sleeping well and how they're growing, helps you be more articulate with your doctors. You can say, I can't bend my child's leg. I've been watching these videos. What's going on at a much early stage? And that's what's empowering to parents.
Phenomenal. Well, Michelle Turner, thank you so much. She's a movement specialist, author of Movementlesson. Evaluate your newborns. What a tremendous gift. Thank you for joining us, Michelle.
Thank you.
For further information regarding the newborn movement assessment, please go to newbornmovementlassessment.com or contact Michelle Turner directly if you're interested in becoming a newborn movement assessment practitioner and or a movement lesson practitioner. She can be reached at movementlesson.com. By joining this exciting community, you will learn how to help infants from the moment that they enter the world and change the lives of countless children and families. Out of necessity to help her globally delayed child, Michelle Turner, Movement Integration Specialist, created Movementlesson to benefit children throughout the world.